chemotherapy ideally should be a treatment that begins and ends, and that it's not forever, but again, like that there's a lot that we can do before, during, and post to really help improve quality of life. And looking at, so I'm going to talk about some, there's so many natural treatments or so many natural things that one could add, and I'm just picking some of my favorites, or the ones that I use the most often. So melatonin. So melatonin is a hormone that's secreted from the pineal gland, and we associate it with the circadian rhythm. And if you attended my sleep talk, I talked a lot about melatonin, and where we even realized that melatonin could be beneficial during breast cancer and actually even other cancers was epidemiological studies on shift work and shift workers. And these are people that basically work at night and sleep during the day, and that there's a higher probability or percentage of shift workers that develop cancers, and specifically actually reproductive hormone-based cancers like breast cancer. So why is this, and why would melatonin have an effect? So if you're someone who does shift work, or also maybe uses a lot of screens, light in itself has a big effect on the secretion of melatonin. And during our sleep, we really want melatonin secretion to be very robust, not just because it can help us sleep better. I mean, again, like if you saw my other presentation, there's other factors besides melatonin that work with sleep. But melatonin has some key core benefits when it comes to cancer. One, it is a very strong antioxidant, and antioxidants, again, are very important when it comes to cancer prevention and fighting cancer. It also is very supportive of the immune system. And so, you know, if our immune system isn't functioning robustly, some of these cancers can be missed and then they progress. But then lastly, specifically when we think of breast cancer, melatonin has an antagonistic effect on estrogen. So if melatonin isn't secreted to large volumes, it is possible that estrogen levels can increase. And it's interesting because you know, it's not so related, but I do work a lot with fertility, and I have noticed a negative effect when patients decide to prescribe melatonin, as it does affect estrogen levels in a negative. Sometimes we actually want good, robust estrogen levels, but when it comes to breast cancer, not so much. And so when we look at melatonin specifically for when someone is under breast cancer treatment, we're looking at very high dosages. Typically the dosage is around 20 milligrams. Most people that are just using melatonin occasionally for sleep are looking more at dosages between 1, although sometimes I'll see some patients self-prescribe at 6 milligrams, but so 20 is typically what we recommend. So modified citrus pectin, and this is actually a really good, not necessarily even just specific to breast cancer, but most cancers. And what the benefit of modified citrus pectin is really helping with the prevention of metastasis. So this is something, if I have a patient who is considering having a biopsy to as a potential for diagnosing cancer, we'll often recommend that they start doing modified citrus pectin prior, just to prevent what we call seeding. So there is a possibility that during the biopsy procedure that you could potentially actually introduce cancer cells to other tissues. So it's something that can be very, very beneficial in prevention of the spreading, basically, because it prevents, it kind of removes sort of like the base that cancer cells need to proliferate, and it can be really beneficial. Okay, so green tea. So green tea has mostly polyphenols. It's very strong antioxidants, and there's been a lot of good research when it comes to both cancer prevention and helping to regress tumor growth. Now, what's interesting, so if you don't love green tea, there's actually some of the equal benefits in coffee, and there's actually been some really great studies showing coffee and coffee consumption in also prevention of breast cancer. So if you're not a big into green tea, coffee could also be really beneficial, but either green tea or coffee could be very beneficial. Okay, so indole-3 carbinol. And this again, if we, as I mentioned before, how breast cancer is estrogen specific cancer. So indole-3 carbinol is a component found in most of your, all your cruciferous vegetables, which are things like broccoli and cauliflower and bok choy and Brussels sprouts. And what indole-3 carbinol does is it really helps with the breakdown of estrogen, and specifically when estrogen is breaking down, it can break down into metabolites that are more what they call like pro-oncogenic or more leaning towards cancer, and also the possibility of breaking down to metabolites that are more benign and are not going to be causing problems. Another form of indole-3 carbinol is DIM, which is something that you might have also seen in stores. And I actually, if I'm prescribing indole-3 carbinol, I really like to use it with calcium D-glucarate, which also helps with the clearance of estrogen. And I use this not just when it comes to breast cancer, but any type of estrogen dominant related conditions, things like fibroids, endometriosis can be very beneficial. So increasing either from vegetables or supplement. So the ketogenic diet, I'll have to say I have a big love-hate relationship with the ketogenic diet. My hate is I just don't like anything that becomes a fad, and then you see like all these like crazy products that people are buying, and that like that ketogenic diet is like the cure-all for everything, and that's going to make you slim and all these. But when it comes to cancer, and not even just breast cancer, but all cancers, the ketogenic diet, hands down, actually, and this is like the crazy thing, even though I have this love-hate relationship with the ketogenic diet, I'll have to say this might be one of my favorite cancer strategies. I'm not going to say necessarily that people should follow it as a preventative, but during cancer treatment, ketogenic diet can be very beneficial. So the reason being is, well, I'll talk a little bit about what the ketogenic diet is, because one, it sometimes gets mislabeled as a low carbohydrate diet, which yes, it is low carbohydrate, but it's more so a high fat diet. We're talking about 60, sometimes 70% of your daily intake of calories coming from fat. So it's a high fat diet. What that means is it's causing our bodies to run on something different. So typically under normal feeding circumstances, our cells run on glucose. I mean, I'm not going to go into all like the biochemistry, but basically by long periods of having a higher fat or having a very high fat diet, it basically teaches the cells of our body to metabolize ketones. And that's where the name ketogenic diet comes from, basically, because it creates these ketone bodies. Why that's so significant when it comes to cancer is cancer cells only know how to run on glucose. So if you're not giving the cancer cells food, glucose, and you're giving your body food on the ketogenic or ketones, you will see progression of tumor cells. And there's been so much great research really supporting ketogenic diet as a part, I mean, it's again, all my recommendations as far from the naturopathic standpoint are not a standalone, meaning I wouldn't necessarily say you can like go on the ketogenic diet and like not go through chemotherapy. That's not what I'm suggesting. but we are showing really great results when it comes to tumor regression, and also even in some cases, patients being able to reduce the amount of chemotherapy agents in comparison with those that do not follow the ketogenic diet. It is not an easy diet to follow. There's a lot of this is I think where my hate comes from, is there's really bad information on the internet, and there's some really bad products out there. I really believe, and this is my own, of course, it's my own opinion, if you're gonna follow the ketogenic diet, you need to work with a dietitian, a naturopath, a nutritionist, somebody who has trained in the ketogenic diet, who can give you a really good plan. Something that I've worked with some of my cancer treatments and my cancer patients is I do use the ketogenic diet, but I give something very specific to them because everyone has different needs. And even though I show this stick of butter, that would not actually be my idea of a ketogenic. I mean, yes, it's high in fat, but when it comes to, and I'll talk about this as we progress, I don't advocate animal dairy as part of a treatment plan for a breast cancer patient, or actually anyone who has a hormone-specific cancer, though there's other fats that I would recommend. So it is very important to work with someone who knows what they're doing, because otherwise I'd say it's somewhat of a waste of time, and it's not a fun diet. And the last piece I'd also say is that it would be temporary. So this isn't, the idea wouldn't be that one needs to be on the ketogenic diet indefinitely. I mean, there's probably some people that would argue with me and they have a different opinion on that. But this is not something that you would have to be on indefinitely, but for it to work, it has to be done 100% and can be really worthwhile, because I actually have seen it in my practice really make a big difference.